Well, it's an annual event, but that doesn't make it any less exciting here at North Oaks. What a beehive of activity in Hammond. As teenagers, students from all over are on hand for the annual physical day. Also, we have Dr. Jeff Witty, who's an orthopedic surgeon, and you're dealing with all of these student athletes, and as we have learned, that takes in a lot of different categories.
It absolutely does. We see student athletes from junior high, even younger, up through high school, and we even provide athletic care for Division I athletes at Southeastern.
Well, as the parent of a dancer at Larandra High School, I can say I'm happy to see all of these girls participating.
Absolutely. You're starting to see more and more girls participating in athletics. I think it's fantastic. Athletics is such a great way to bond with friends, stay in good shape, promote a healthy lifestyle, and so we're excited to see all comers.
I want to talk more about it, but first, before I forget, I hear that you're now a published author in your profession, recently doing a medical journal entry on the subject of arthroscopy for elbow injuries.
That's correct. Myself and one of my old mentors, Dr. Hopgood up at Mississippi Sports Medicine, we recently wrote an article on diagnostic elbow arthroscopy in the journal Operative Techniques in Sports Medicine. And the article outlines the technique of elbow arthroscopy and the diagnostic portion of that procedure, which really serves as the foundation for other types of procedures that you can perform with elbow arthroscopy. And allows you to perform more advanced type of procedures to the elbow.
So how does this help you in your work? I mean, I'm thinking about maybe baseball players, golfers, tennis elbow.
Right. So a lot of people suffer from elbow problems, and probably the population that gets the most attention are the overhead athletes, our throwers, pitchers. Every now and then we get some track and field, javelin, discus, and that type of thing. Volleyball players, and so those are more the type of athletes that we get in. But elbow arthroscopy is also a procedure that we can do in patients who don't participate in those types of activities, who just get some tennis elbow problems, some forms of osteoarthritis of the elbow can be treated with elbow arthroscopy.
You know, there are so many advances in this kind of surgery that now what we're describing, it's just about on an outpatient basis.
Yeah, elbow arthroscopy is typically done on an outpatient basis. We take that on a case-by-case type of situation, but the majority of cases we do outpatient. And what I mean by arthroscopy really is we use a camera through small incisions to access the elbow joint, and we can treat a multitude of problems minimally with a minimally invasive technique.
And you can do all this here at North Oaks, I guess.
Yes, absolutely. Mm-hmm.
So let's get back to the event today when hundreds of teenagers are coming in from various schools. What are you screening for?
Essentially what you're asking is what are the components of a pre-participation physical examination, and there are a variety of components, and there are some requirements put forth by the Louisiana High School Athletic Association, and we cover all of those requirements stipulated by that body. And that includes a history, which can range from any sort of medical problem, prior surgery, prior injury, allergies, and those types of things, to physical examination, vital signs, and we have a lot of different specialties here, and that's where North Oaks is really positioned well, because we have a multi-specialty physician group that can check heart, can check lungs. We have our orthopedic sports medicine team, which can do joint evaluation, shoulders, hips, knees, all that kind of stuff, all under one building.
So do you often find problems that you can then treat?
Yes. So fortunately, we don't have to disqualify athletes very often at all during this initial screening examination. On occasion, we do pick up a few things that require perhaps additional screening or additional testing, but it's uncommon to have to completely disqualify an athlete during the screening process.
It occurs to me, though, that parents are probably very happy to get some of these diagnoses, catch them early.
Yeah, and that's another benefit that's been recognized with these pre-participation physical examinations. You can catch a problem early, and in a lot of these athletes, this is really their only medical screening for the entire year. and it allows us to get them in to see other types of specialists to look into some problems further if they pop up.
Well, as exciting as this is in Hammond, it occurs to me that there are people thinking that they wish they had been here, but to get a second bite at the apple, you'll do this in Livingston as well.
Yeah, on May 12th we have another screening examination out in Livingston. We'll have the same services. We will provide all the components to the physical examination, the pre-participation examination to make sure we get all of our athletes taken care of.
Well, things have certainly changed since back in the day when coaches would tell football players to just work even though it hurts, and then also wouldn't allow them to drink water during practices and so forth.
Yeah, that is not the thought process these days. We really strive to provide education and accurate information to our coaching staff, parents, and athletes, so we can keep our players out on the field as much as possible and to participate safely. And so one way that we do that is our coaches seminar, which is held August every single year, and we provide lectures to the coaches, to other athletic staff on a variety of topics that help inform them and keep them up to date on the latest in sports medicine.
What else do you want to share with us?
Well, this is our 27th annual North Oaks Sports Medicine Physical Day, and we're all excited to be out here to provide this service to all of our student athletes. Our sports medicine team includes 3 physicians. We have 8 athletic trainers full-time that provide services to 28 different schools. They are out on the field during practice, during games, to provide on-field injury management, injury recognition, and proper referral if necessary. We also have concussion management with some of our providers, and so we really can provide a unique service here in Hammond at the North Oaks facility and our clinics in Livingston that's unique to this area.